What's on with your nose?
So, like, I could barely breathe out of it. It's always congested, even if there's no mucus or anything in there.
Okay.
And it's hard to breathe, it's hard to sleep, it's hard to do anything.
Okay, so it's a breathing issue kind of situation. Yes. She tried to get you to use the nasal sprays. Were you able to do that?
I used all the stuff she gave me.
Did you? Okay.
And stuff. Other stuff.
Well, tell me everything that you used.
So, I've used the spray, the prescription medicine she gave me. I use like nasal bandages. I've used nasal drainage, like the bottle with the water, saline rinse. I've used like Vicks. I've used decongestants. I've used.
How long have you used that stuff?
Oh no, for that stuff, well, each thing I used was like different time frames of it, but I would say I've been trying different things probably for like a year or two now.
Let's talk nasal decongestants. How long did you use that?
Whatever the amount that they told me to use it for. Yeah.
How about the nasal steroids and then saline?
None of that helped. She told me to take it for 90 days, I believe. And then if it didn't work, to let her know. Okay.
And you did it for the 3 months and it didn't work? Okay. And she did a scope on you back end of last year, correct?
Yes.
I'm going to do a little exam on you, and then we're going to go over the CT scan, and then I'm going to talk to you about what's going on there, okay?
Okay.
Do you have allergies? Do you have sneezing, itchy eyes type of stuff?
I've been to the allergen, and they say I don't have any allergies. I have more like skin allergies, but my breathing also though, like my eyes do get red sometimes, like very quickly dries out and it itches. But it's not all the time, and so those things like all the time.
Any smoking?
No.
Also, stop cleaning out your ears.
Oh, what?
You're cleaning them out too much.
Yeah, because they irritate me.
How?
I feel like it's like annoying, like to feel like there's stuff in there, and it sometimes itches and it's bothersome.
So this cleaning them out makes that worse. You got a little what we call exumatous otitis. It's like eczema reaction in your ear canal. The more you scratch it, the more you irritate it, the worse it gets kind of situation. You can use like an over-the-counter steroid, or it can be prescription steroid ointment to put in there every now and then. That can help the itching kind of stuff. Do you want me to send you a prescription for that?
Yeah.
I'll also print out some instructions at the end of the visit today to tell you how to use that. But basically, put a half pea size on your finger, put it right there, and let it just melt in. And then don't clean out your ear, don't put water in your ear, don't mess with your ear otherwise, okay? Do that.
What about when I shower though? Like, because water gets in them.
So don't try to don't get water in, don't put the faucet in there.
Okay.
After the shower, if you feel like there's water in there, use a hair dryer, arm's length away. Just put a little warm air in there, and that should evaporate any water you need to get out of there. Okay. Don't use a Q-tip, or don't try to clean out with.
So how do people clean out their ears?
You're not supposed to.
So it just builds up a bunch of wax?
No. So what happens is the skin in your ear canal is like the skin on your hands. It flakes off. When it flakes off, it takes out extra wax with it. And it can kind of drain out your ear a little bit, and you can kind of clean it up out there, and that's not as big of an issue. But that's the way it normally works. Very few people actually have buildup of wax where it causes problems and stuff like that. Okay. It's more likely using the Q-tips is pushing the wax farther down where it can't come out and causing those kind of buildup issues. Quick peek at your nose. Is there one side you can't breathe out of more than the other?
Sometimes. Sometimes it's the right side where I can't breathe out. Right now it's the left.
So it kind of goes back and forth?
Yeah.
Yeah, that's the nasal cycle. That's where we'll go and put your tongue back in. Open wide. Keep your tongue in. Open wide. Go ah.
Oh.
Good. Tongue's supposed to.
But like the stuffiness, sometimes like it feels like right in those areas it gets like really tender, and then my ears start hurting, and then it feels like it's draining in the back of my throat.
Yep, I can see it draining in the back of your throat, and that focus drainage can cause a lot of those kind of symptoms. That's inflammatory disease. Go down the back of your nose. So let's look at a CT scan. So CT can. Have you ever looked at a CT scan before?
I have. I don't understand it.
I'm gonna actually look at her images that she did back a couple months ago. It's probably just gonna show inflammation. Yeah. No pus. Just inflammatory disease. Yeah, pretty normal. Okay.
I don't have any like polyps or anything in there.
On the scope, no.
Okay.
On the CT scan, also no, but we'll show you that. The way this is gonna work, is gonna take little slices of your head from front to back. Shades of gray, some sort of soft tissue, fluid, inflammation, blood, muscle kind of situation. Bone's gonna be white, air's gonna be black.
Okay.
So you see your tip of your nose right here.
Yeah.
Your nasal bone, your upper lip, your forehead, your cheeks coming in right in there, your eyes. So these are your sinuses. This is the way sinuses are supposed to look, completely air filled, kind of black like that. Your cheek sinus is the same thing. You got very, very, maybe a little bit, they call it a little inflammation in your maxillary sinuses, which we're talking about this thing right here, which I do not think is significant. It's nothing, it's non-disease kind of situation. You can see right here where your cheek sinuses, the outflow tract are open, no problems with that. You do have a lot of inflammation in your nose, what I call rhinitis. You can see like right there, like all this stuff is open and drained appropriately. You do have some concha bullosa kind of situations there. You got a little spur in the back of your nose on that left side, but the majority of your issues is just this inflammation right there. Goods and bads. So good, you don't have chronic sinus disease. You don't have issues that like surgery to open up your sinus like that's needs to be done and stuff like that. With that being said, there's very little that can be surgically done to improve your symptoms. So you do have some causes of having left-sided nasal congestion, this thing right here, which we call concha bullosa, and this little spur on the left side. Taking those out might improve the nasal congestion on your left side a little bit, but I don't think it's going to be relevant because your right side and your left side, you're saying basically have the same nasal congestion, which I think is this right here. You have very large inferior turbinates. That is inflammatory disease. That's from like anything from allergies, colds, stuff like that. That is not surgical disease. Okay. The stuff that helps that is the nasal sprays, and that's the only thing we have to really great to help that, or preventing what's causing the inflammation, whether it's allergies causing, if you smoke, if you're smoking can cause it, dust can cause that, stuff like that, over dryness of your nose and stuff like that can cause it. Okay. So the bad part about that is the sprays that you say don't work is our treatment for that stuff.
Right.
So you're kind of, so I don't think I have that much more to offer you, to be honest. Mm-hmm. Does that make sense?
Yeah. She had told me I have like a deviated septum. Is that?
That's this thing right here.
Okay.
So that's that little spur right there. That's technically deviated septum. It's a little bit pushing off to that left side. And so the anatomy you have and the deviated septum, if you came here telling me that my right side's okay, my left side I can't breathe very well out of, then I might say we could do some surgery to improve that left side. Mm-hmm. But anything we do is not going to improve your right side nasal congestion, and at best is going to make your left side as good as your right side. Mm-hmm. And so from your symptoms, what you're telling me, that's not going to help you. Yeah. And so I don't think it's worth going through surgery, putting you through the torture that's not going to help your symptoms. Does that make sense?
Yeah.
So
it's an issue, like especially like if I'm sleeping, it's like so congested that I cannot breathe out of either side sometimes.
Is it worse at night? Is that where you usually have problems?
Not necessarily, because sometimes during the days.
So, I mean, then you have to find out what was causing that inflammation, because you have rhinitis. You don't have sinusitis. So you have rhinitis. And it's one of those things you got to find out what's causing that rhinitis. And it could be anything from, like, allergens or just dust, or like campfires or any sort of smoke or anything like that. Can cause that. Even if you're not allergic to it, can cause still inflammation. Yeah. I mean, in general, using the nasal sprays, the high volume nasal irrigation and nasal steroids every day, mm-hmm. generally that usually doesn't resolve issues, but improves it to the point where it helps it out a little bit. A couple of things that help, especially at night, is one, elevating the head of your bed slightly. Mm-hmm. That can help a lot. Also, um, keeping your bedroom temperature cool
Yeah.
because it decreases inflammation in your nose from shunting of blood and stuff like that can help out nasal congestion at night. The other thing, if you have any acid reflux, that can cause some significant swelling in the back of your nose, especially if you have reflux at night into the back of your nose, which would make it look like you have postnasal drainage and look in the back of the throat and stuff like that.
Mm-hmm.
So I think trying to find one of those things is some sort of that the tools you already have.
Yeah.
Trying to find out what works best for you in those kind of situations is probably where you're going to get the best improvement overall.
Okay.
Okay.
So I have an air purifier, and it tells me like basically when the air is clean and things like that. So I have one of those. I use a humidifier, one of those, where you like put the Vicks little scented things in it.
So I don't like the Vicks scented things. I don't think they improve things at all. They cause irritation to the nose.
Okay.
Humidifiers can help
Okay.
moisturize, especially if your air is really dry, because that can cause inflammation. Not as much as a nasal saline. Dehumidifiers are better, sometimes really good, especially if you have especially here in Oregon, sometimes you have some extra humidity and mold and stuff like that in your houses, and that's what helps with that kind of stuff sometimes. So it depends on your environment.
I sleep with a fan, and like all the time.
Mm-hmm.
When I'm not in front of a fan, I feel like overly heated.
Yep.
My body does. So I don't know if the fan has probably dust and stuff that it
That
goes
can
around.
definitely be a problem, especially if you don't clean your fan out regularly. It can blow dust into your face and cause more nasal congestion issues.
Okay. Trying to see what else I do. It's hard to be active and because I don't get a lot of sleep because of my nose, but also work out and things like that to be able to breathe is very difficult for me to do that as well.
Okay. I hear you. And I'm telling you that what I'm seeing in your nose is inflammatory disease, rhinitis, which is generally not a surgical disease.
Yeah,
It's the topical medication kind of situation. I mean, I think trying to figure out what's really causing it in your environment and removing that or modifying it in some way is probably what's going to be best for you long term.
Okay.
Okay.
So if that spray didn't work, are you thinking there's another spray?
Not really. So you could try other nasal steroids. There's other nasal steroids that you could get over the counter, like Nasacort and stuff like that insurance doesn't usually pay for, and so you just have to go over the counter. And sometimes for some people, they work better. The research says they all work about the same though, so there's not significant better. A lot of times it's about application and how you use it. One of the things is cleaning out your nose with that nasal irrigation first, then using nasal steroids. Sometimes it usually helps out much more because it gets the mucus and stuff like that out of there, and so the nasal steroids work better in kind of situations. To be honest, most of the time people don't use it long enough to get the benefits because it's usually not one of those things you put in there and you feel better. It takes weeks and weeks and weeks to actually build up and decrease that inflammation to actually notice any difference. And that's the biggest problem we have with it because it's not instantaneous relief. It's one of those slow maintenance kind of situations. Like you brush your teeth to prevent cavities kind of situation. You brush your teeth one time every month, you're not going to feel like it does much anything.
So is there a point in time where I don't if I'm using a nasal spray every day, long term, if I start feeling better, do I stop or do I continue?
Generally not. Generally, if it's one of those things, it's a lifetime management type of situation. It's something that's causing inflammation. Something's creating inflammation in your nose, and that's what's battling it. Sometimes, if you move or you change your environment a little bit, and then it gets better on you. Sometimes we grow out of stuff, but generally, for the most part, it's a lifelong type situation.
Okay. And I've used Sudafed, I believe. You have to get it from the pharmacist. That didn't help either.
Okay, that's a decongestant, oral decongestant kind of situation.
Yeah.
Sometimes that helps, sometimes that doesn't. It makes me think it's not allergic response if Sudafed doesn't help, because Sudafed usually helps a lot with allergic response in this kind of situation. But so I don't know. You're kind of hard because the management we have for these kind of things, it seems like you're using is just not improving things, and we just don't have much else for you.
Right.
We have the nasal sprays, maybe some oral antihistamines, oral decongestants, allergy management, doing the allergy testing. You've already done all that kind of situation.
Okay.
And then that's when we go see if there's anything surgical we can improve on. I mean, there's things in there that are abnormal and I can take out. I just don't think it's going to improve your symptoms.
Yeah, I don't want to do something just because I don't want to go through that.
which granted is not a bad surgery. People generally recover pretty well from it. It's a couple days to a week of not being the happiest, but I just don't see, from what I'm seeing on exam, on the CT scan, I don't think it's going to cause a significant improvement of symptoms, because I think the majority of your issues are on this inferior turbinate inflammatory disease.
So those are going to get smaller if the congestion is gone, or if the inflammatory is gone?
So that is inflammation.
Yeah.
So if the inflammation improves, that should get smaller, which should improve your congestion issues.
Okay.
That's the idea with it. There are some surgeries you can do to decrease that tissue in there. It just doesn't, it's like inferior turbinate reductions and stuff like that. It's not long term. It doesn't help long term. It comes back on you within 6 to 12 months kind of situation.
That sucks, yeah.
And it takes about a month of increased inflammation until you start noticing improvements, and then it improves, and then if you don't find out what's causing the inflammation, it kind of just slowly comes back on you. So it's not long term improvement. We do a lot of those kind of surgeries if we're doing something else in there, because that short term improvement is somewhat beneficial. I'm not a big fan of just doing that just to help for like the next 6 to 12 months, especially since we have to do it in the OR. That tends to be really expensive for people.
Trying to see. So should I stop using a fan? And
I mean, if you can't sleep without the fan, you can't sleep without the fan. This is all about symptomatic, what helps you the most kind of situation. The fan might be causing some dust, might be causing more nasal congestion issues. Again, any acid reflux you have, try to treat that.
Yeah.
Because that can definitely cause inflammation in the back of your throat, up into your nose. There's acid, really bad reflux can get up into your nose at night. The fan can cause it with dust and stuff like that, and irritation in your nose. Make sure to clean out your nose. Use the nasal saline, nasal steroids on a routine basis, and try to change some stuff in your life. Like if you have carpets or something like that really bad, try to vacuum up your carpets 3 times a week for a couple months and see if that improves things or something like that. Try to decrease environmental exposure. If you have cats or dogs, don't let them sleep in the bedroom, because that can cause dandruff and inflammation type situation stuff.
Can dust mites or your mattress itself cause?
It can. That's where dust mites and the vacuum and stuff like that. Usually, if you have really bad dust mite allergies, they'll pop up on allergy testing, which the allergist, that's one of the standard things they usually test for. But that can make sure to keep my sister has really bad dust mite allergies. She changed her sheets every week. She took out all the carpet in her house, put whole hardwood floor, because it just makes her sinuses and her nose better kind of situation.
I can't do that with my carpets. It's the whole house. We don't own our house, so can't do that.
And it's really expensive. I can't believe my sister talked about her husband into doing it. But my sister's kind of one of those. She told her husband to do something. He's like, yes, dear. So
that's sweet.
Anything else? I know it's hard. It's a hard pill to swallow. There's not an easy fix to this.
Yeah. I'm just glad I don't have to do surgery. But I'm trying to figure out what it could be, what I could change, because I've done so much in my house that it hasn't helped yet. Yeah. So I don't know exactly what to pinpoint and be if I take this away or change this.
Cool. My first step would be, again, restart the nasal saline irrigation, the high volume stuff to really clean out your nose. Do that every single day. Do the nasal steroids, and just get in a routine of doing that, and then start changing things around your house and see how things work. Okay?
So should I use the one that she had prescribed, or over the counter?
They're the same stuff. Okay. So the Flonase, fluticasone, that's just a nasal steroid. It's the same. You can get the exact same thing over the counter. Generally, we like to send prescriptions, so insurance companies pay for it. Yeah. But it's the same medication, it's the same dosing, all that kind of stuff. Okay. You could try some other ones that are a little bit different, as long as they're nasal steroids. I don't like nasal decongestants. That causes rebound congestion, which makes your symptoms slowly get worse over time, which is bad. So no Afrin, no neosynephrine, or any of that kind of stuff. Those things are bad for your nose.
So you would recommend Nasacort, Flonase?
So nasal steroids.
So I think I had Flonase in the past, and it said the first time you take it for this many days and then you stop use,
Yeah, so that's because there's a risk of nasal dryness and nosebleeds with Flonase and nasal steroids.
Okay.
As long as you're not getting nosebleeds, they're safe to use long term. Okay.
Every single day.
Mm-hmm.
Okay. Because